Therapeutic Effect of Psilocybin in Addiction, a Systematic Review. This was published online February 9th, 2023 in the National Library of Medicine, National Institute of Health. Abstract background. Psychedelic assisted therapy, example, with lysergic acid, diethylamide, LSD, has shown promising results as treatment for substance use disorders, SUDs. Previous systematic reviews assessing the efficacy of psilocybin in SUDs only included clinical trials conducted in the last 25 years, but may have missed clinical trials assessing the efficacy of psilocybin that were conducted before the 1980s. Given much research has been done with psychedelics in the mid-20th century, in this systematic review, we specifically assess the efficacy of psilocybin in patients with an SUD or non-substance related disorder, with no publication date restrictions in our search strategy. Methods. A systematic literature search was performed according to the preferred reporting items for systematic reviews and meta-analysis guidelines from the earliest published manuscripts up to September 2nd, 2022. In 7 electronic databases, including clinical trials in patients with an SUD or non-substance related disorder evaluating the efficacy of psilocybin. Results. A total of 4 studies, 6 articles, of which 2 articles were long-term follow-up results from the same trial, were included in this systematic review. Psilocybin-assisted therapy was administered to 151 patients in a dose ranging from 6 to 40 milligrams. 3 studies focused on alcohol use disorder, and 1 study on tobacco use disorder. In a pilot study, N=10, the percentage of heavy drinking days decreased significantly between baseline and weeks 5 to 12. Mean difference of 26.0. 95% CI equals 8.7 to 43.2, P equals 0.008. In another single-arm study, 32% became completely abstinent from alcohol. Mean duration of follow-up 6 years. In a double-blind, placebo-controlled, randomized controlled trial, the percentage of heavy drinking days during the 32-week double-blind period was significantly lower for psilocybin compared to placebo. Mean difference of 13.9. In a pilot study, the 7-day point prevalence of smoking abstinence at 26 weeks was 80%. At 52 weeks, 67%. Conclusion. Only 1 RCT and 3 small clinical trials were identified, assessing the efficacy of psilocybin combined with some form of psychotherapy in patients with alcohol and tobacco use disorder. All 4 clinical trials indicated a beneficial effect of psilocybin-assisted therapy on SUD symptoms. Larger RTCs in patients with SUD needs to evaluate whether psilocybin-assisted therapy is effective in patients with SUD. Introduction. Globally, the 12-month prevalence of substance use disorder is 2.2%, with alcohol use disorder as the most prevalent, 1.5% of all SUDs, excluding tobacco use disorder. The 12-month prevalence of SUDs is even higher among high-income countries. Alcohol use accounts for 4.2% of all disability-adjusted life years, while drug use accounts for 1.3% of all DALYs worldwide. In addition to the detrimental health consequences, there are enormous economic consequences of SUD, with an estimated cost of $249 billion from alcohol, $300 billion from tobacco, and $193 billion from other drugs a year in the United States of America alone. Despite these adverse health and economic consequences of SUD, therapeutic options are still limited. Food and Drug Administration FDA-approved medications are available for alcohol, tobacco, and opioid use disorders. Still, for other SUDs, such as cocaine and cannabis use disorders, no approved medications are available. Relapse rates remain high across all SUDs, with greater than 75% of patients with primary cannabis and cocaine use disorder, and greater than 65% of primary alcohol and opioid use disorder showing relapse throughout 12 months after evidence-based treatment. Arguably, relapse rates are even higher in non-substance related disorders, as greater than 90% of patients with gambling disorders who had recently quit gambling showed relapse throughout 12 months. This means that there's an unmet need for effective treatment for SUD and non-substance related disorders. Psychedelics, example with lysergic acid diethylamide, LSD, has shown promising results as treatment of SUDs. In the majority of studies, some form of psychotherapy was given in combination with the psychedelic treatment, but not in all, which is usually referred to as psychedelic-assisted therapy. Psychedelic-assisted therapy comprises 3 stages. 1. Preparation. 2. The psychedelic session. 3. Integration. Preparation is thought to be vital for maximizing the potential benefit from the psychedelic session, while integration is believed to be important for prolonging the improvements. Currently, interest in the efficacy of psychedelic treatment for SUDs is increasing. The term psychedelic was first proposed by Oswald in 1957 and comes from the Greek word psyche, i.e. mind, and delon, manifesting, and refers to the subjective effects of these agents. A categorization of psychedelics can be made based on their chemical structure into 3 different classes. 1. Tryptamines, example psilocybin. 2. Ergolines, example LSD. 3. Phenethylamines, example mescaline. All these agents are closely related to the endogenous neurotransmitter serotonin and induce their effect via activation of the 5-HT-TA receptors. Sometimes a more broad definition of psychedelics is used, and dissociates and deliriants, example, ketamine and ibogaine, are included as well, which have a different mechanism of action. Swiss chemist Dr. Albert Hofmann first synthesized LSD in 1938. While he first identified psilocybin and its active metabolite, psilocybin, as the psychoactive compound of the psilocybin mushrooms in 1958. In the subsequent year, he synthesized psilocybin, which was later marketed as psilocybin by the pharmaceutical company Sandoz. Throughout the 1950s and 1960s, considerable research was conducted investigating the efficacy of LSD and psilocybin for various conditions, including anxiety, depression, and existential distress in patients with terminal cancer, in patients with opioid use disorder, and in patients with alcohol use disorder. Possible therapeutic mechanisms of psychedelics might be at the biochemical, neural, and psychological level. Krebs and Johansson conducted a meta-analysis of randomized controlled trials evaluating the efficacy of LSD for alcohol use disorder. They identified 6 eligible trials, including 536 patients, and found a beneficial effect of LSD on alcohol use disorder with comparable efficacy to disulfiram. Savage and McCabe also found a beneficial effect of LSD on heroin use disorder in 78 inmates of correctional institutions. However, in 1970, the Controlled Substances Act was signed into law by former U.S. President Richard Nixon, placing psychedelics such as LSD and psilocybin in Schedule I, meaning has a high potential for abuse, has no currently accepted medical use and treatment, and has a lack of safety for use under medical supervision, which hindered conducting psychedelic research. Other factors, such as negative publicity about psychedelics, doubts regarding their efficacy, and allocation of funding to related research fields, example schizophrenia, increasingly discouraged research on psychedelics. Recent years have seen a resurgence in psychedelic research, a development sometimes referred to as the psychedelic renaissance. Since 2016, 3 systematic reviews have been conducted evaluating the efficacy of psychedelics, example psilocybin, but also other classic serotonergic psychedelics such as LSD, were included in these systematic reviews as a treatment for psychiatric disorders. Example SUD, but also other psychiatric disorders such as depression and anxiety, were included in these systematic reviews. Although these reviews provide an excellent overview of clinical trials published in the last 25 years, including multiple psychedelics and conditions, they may have missed clinical trials evaluating the efficacy of psychedelics that were conducted before the 1980s. As shown by Fuentes and others, many trials have been conducted assessing the efficacy of LSD and SUD in these early decades, which may have been an important era for psilocybin research as well. In addition, many trials evaluating the efficacy of psilocybin and SUD have been started since 2016, some of which may have already been published and not yet included in previous systematic reviews. Therefore, we performed a systematic review without restrictions on publication date. Our aim was to assess the efficacy of psilocybin in patients with SUD and non-substance related disorders, example gambling disorder. In addition, a quality assessment was done of the included clinical trials.